Welcome back to my channel. So if you watched my previous video, you would know that I am a new CNA. I have almost been a CNA now for 3 months. It will be 3 months in 2 weeks. So yeah, I am still new, I'm still fresh, I'm still learning things every day, but I decided to share some tips and tricks with you guys. Things I wish I knew when I just started, but I started to learn, as time went by. So let's get started. Okay, so the first tip I have for you guys is to wear compression socks. The job of a CNA is a very hectic one, and you will be required to be on your feet for hours upon hours. Yeah, so compression socks, they really help with preventing your feet from swelling up or from aching at the end of your shift. When I started my job as a CNA, for the first couple of days I wore compression socks. So I said I'm gonna go 1 day without them and see if that makes a difference. And trust me, by the end of my shift, my feet were killing me like crazy, and I said never again. So yes, invest in some compression socks. They're very cheap. You can find them on Amazon. Number 2, always walk with extra gloves and extra garbage bags. I cannot tell you the amount of times my gloves decided to pop while cleaning a patient, or just dealing with mess in general. You want to double up your gloves. The outer one tears, you will always have the inner one as backup. Or if you need to change your glove, you can just peel the top one off. So if you walk with extra gloves, also you will always have extra just in case you need to switch your gloves out and get new ones. So yeah. So tip number 3, let the start of the spongy part of the brief line up with the start of the crack of the patient's butt. Okay, so I have a brief right here. So what you want to do is to ensure that the start of the spongy part lines up with the start of the linear groove between the patient's buttocks. So that will help to prevent pee from, soaking their clothes or whatever the case might be, especially if they are lying down. When I just started, I had a hard time figuring out how to position the brief, and most times a lot of it, too much of it, is always in the back, and it's always a struggle to pull it out, and you don't really want to do that. So just letting you know now, that's how it should go. Line up the start of the spongy part with the patient's booty crack and you'll be good. So my next tip is walk with scissors if you don't have scissors. The scissors will not come in handy when you need to put new briefs on, but it will come in handy when you need to take the diaper. When you need to take the brief off. So yes. Another tip is don't say diapers. Never refer to diapers as diapers. Refer to them as briefs. Some patients will not mind, but others, they feel disrespected and feel as if they have no dignity left because, hey, I know that I can hardly help myself, but now you're telling me that I'm wearing diapers also, the things that babies wear. So a good term to use is briefs. When you say briefs, some of them might not understand what you mean, so you can just explain it to them. But in order to prevent a fuss or a problem, or them not cooperating with you to get their briefs changed, call them briefs and everything will be okay. When you're getting your patients out of bed, some of them you have to take to the toilet. So while the patient is on the toilet, you can get their top area washed up and put their clothes for the day on. Or if they're patients who can do things for themselves, they can wash themselves up and put their clothes on. You ensure that you bring their clothes with them into the bathroom. Let them get dressed and stuff while you make their beds. So after you're done making their beds, you're done with that room and you can move on to the next patient. So that's a good thing, just to multitask or to save yourself some time. While the patient is on the toilet, find something to do also. If it's a patient who needs supervision, then you know that you'll have to be in there with them and help them out. So if you have to comb their hair or whatever the case might be, you can do that. But that's a good thing to note to help you with saving time, because as a new CNA, you're gonna take longer to do everything. You don't have a routine, you don't know who to get out of bed first, you don't know your patients. So when you get on the floor, find out which patients are able to help themselves more, which ones need to be toileted, and so on, so you'll know that those patients you can get out of bed first. So the final tip for today is when you're giving a patient a shower. So for the shower chairs at my facility, there is an opening there with a slot that you can push like a bedpan into. It's not really a bedpan, but it's a circular container that you push underneath there to prevent the patient from pooping in the shower. So sometimes they poop, sometimes they don't. If you are finished, then you can quickly take the bag out and wash their booty, and that's it. But in order to prevent a mess, you can put a bag there, or you can put that container there. If you are putting the container, I would suggest putting a bag inside the container, so you can just take the bag out and throw it in the trash instead of having to clean up poop from out of the container. A lot of times when you're transferring the patient from their room to the shower room, they poop on the floor, and we don't want that. That's a lot of mess. So now that I mentioned poop on the floor, I have another tip. The last tip. This is the last one, I promise. So in order to get rid of the smell of poop because they pooped on the floor or in the shower, you can use a shaving cream. So after you wipe up the poop, you're still gonna smell it. So just spray some shaving cream on the spot and rub it out, and afterwards you will not smell anything. I promise you, you will not. There you go. I hope you find these tips helpful. They really have been helping to make my job easier. I am still trying to develop a system because every time I go to work, they place me on a new floor. So a new floor means new patients who I know nothing about. So it's always like I'm starting over, but once I work the floors enough, then eventually I will get to know the patients. I must say I have gotten to know a lot of the patients, and they're the ones who are keeping me going. I mean, I am surrounded by a lot of mean and nasty CNAs and nurses. I'm also surrounded by a lot of good ones, and that's okay. A lot of times I just feel like I would just not go back to work because of how they treat me sometimes. I wouldn't say me in particular. That's how they treat everyone. I'm figuring that it's because they're unhappy with their job or with their lives, and that's no reason for you to take that out on other people. But anyways, my patients keep me going. I love them. They make me happy, and that's the reason why I continue to do this job right now. I'm currently working on getting my nursing degree, so yeah, I guess we can talk about that at a later point. But thank you so much for watching my video, and I will see you in the next one.